Hi, Shannon. Happy Friday. Thank you. All right, so I am back to lives. This was a very schedule-filled week. I will say that. But it's all good. It's all good. Alrighty. We'll give some more people time to come in. Tonight we are talking about provider communication and how important it is, guys. Being a good medical coder is just a part of it. If you can get that trust, if you can get that communication down, you don't know how helpful that is and how much people don't think about just something as simple as building trust and that communication. It goes a really long way. So hopefully I can pass on some very valuable information to you guys tonight. Hi, Yvette. Thank you for the blue hearts. And hopefully this will help you in your careers, right? Whether you are a student, it never hurts to start learning early and developing these habits. Or if you have been a veteran coder for a while and you're looking to up your game, well, you come to the right place. Hi, Maria. Hi, Angie. Thank you for the blue hearts. All right, so we're going to go ahead and get started. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Tonight, I'm going to be talking about provider communication and building trust. It's all about the details. So let us begin. Okay. So yesterday, I posted on Instagram. I made a post, which was the inspiration for today's episode. I posted on Instagram 3 consecutive messages that were posted on my videos because I get them all. I see them as they come in. And on these comments, all 3 comments were calling me Blue, B-L-U-E. They were spelling my name B-L-U-E. A couple of them were not capitalized, and then the other one was capitalized with B-L-U-E. And I get a lot from people, well, it's just a typo. It's just a typo. And here's the thing, guys. I used to let this stuff go because it was like, you know, of course, my name is unusually spelled, okay? We have my aunt to thank for that. But when it comes to getting into the habits of detail now, I'm telling you guys to get into the habits of detail, because when you get into the real world, or if you're in the real world right now and you're dealing with these providers, they have just 5 seconds they're going to give you as soon as they meet you, or as soon as you start sending them emails. It is going to be about 5 seconds of building trust. They're going to know, one, if you're coming at them with helpful information, with information that is going to be useful to them, or if they think that you're going to waste their time, they will know this within 5 to 10 seconds because of how you're presenting yourself. So if you are just doing it completely on email, it is just a lot of email communication, it is harder to build a relationship and to build trust when you have just email, only electronic communication. It is much easier if you are in person. However, that's not the world that we live in right now. So for some it's going to be in hybrid, and others, you know, it's just not. So it really all depends. But getting the salutations down right, getting the spelling down right is key. And I'm going to start, because the thing that I do on my channel is share this information. So if I'm walking the walk, I got to talk the talk, right? So that means that every time you guys misspell my name, even if it was just a typo, You know when you post a comment to course correct. You see it. I know for me, I look at the comment that I write, and then when I post it, sometimes I look at it again because you may have missed something. And if I miss something, or if I misspell something, or I used another word, I will go back and correct it. You guys have to get into that habit as well. So every single time I see my name misspelled, I'm going to be correcting that person, because that's going to get you into that habit of watching those details, watching details, because then it's going to be like, oh, I got to make sure I spell her name correctly. Yes, because number one, it's a respectful thing if you spell somebody's name correctly, number one. Number two, when you're addressing somebody, you don't start their name with a lowercase letter. I know this is a different generation now where everybody thinks it's okay to not use punctuation, not use capitals, not use lowercase appropriately. But when you are in the business or professional world, these doctors, they don't care how cool you think you are. You better come with your A game. That's how they're going to be looking at you. So when I see coders, and I've seen them before, where I'm proofreading emails from other coders, hey, Blue, can you look at this? And they're not using correct grammar, they're not using proper English, and they're not even doing the salutations correctly. Sometimes I have seen, and I will see Mr. Smith instead of Dr. Smith, Mr. Smith. You never do that when you are addressing a provider. There is no reason. There is no reason to do that, ever. If you know that person is a doctor, you address them as doctor, because that builds trust. If I'm a doctor and I see somebody that addressed me as miss instead of by my salutation properly as doctor, oh, I don't want to hear from you. And it may be, wow, Blue, that's really, that you're being very picky. People are going to be way more picky than me. Trust me. So that's why you got to be sharp. And my providers trust me. Why do they trust me? Because they know when I talk to them on email, I write properly, I address them appropriately, I spell their name correctly, and a lot of them have very unique spellings on their names. I always double check and make sure that the spelling is correct, especially when it comes to their name. So that is something that you got to get, and it's a little thing, yes, but it's these little habits that will teach you to be somebody that people can trust. You're somebody that's going to be looking at those details. Because if I see somebody that's not looking at details, and this is a person that's the coder, that's my coder, oh no. I don't even want to mess with this person, because this person doesn't know what they're doing. And that's immediately what you're going to run up against, is these doctors are going to look at you like you don't know what you're doing. And some of them may not even know you from Adam or Eve. They're just going to look at you like, oh, okay, I don't know you, but you don't know what you're doing. I'm the doctor. I say this is what I want. This is what you're going to code. No, sir, no, ma'am. If it's not supported, we are not going to pick this up. There's a difference in the relationship between nurses and doctors and medical coders. It's night and day difference, because we are there to help the provider, and we are there to interpret their documentation based on what they have documented. Where the nurse is going to work under the direction of the doctor. They're going to do whatever it is the doctor tells them to do. We don't have that where we're told what to do by the doctor. We are interpreting what the doctor is saying into codes. If there are things that are missing, if there's documentation that can be clearer as to what is actually happening, and once you start getting that clinical knowledge, being in the clinic and really understanding the pathology of what's going on with these conditions that you're commonly coding, then you're going to be able to see there's holes. That's what CDIs do. And you don't have to have that certification to get into that mindset and start looking at those things. CDI, or clinical documentation improvement, clinical documentation integrity, is a very powerful thing to be able to do. But if you want to get there, you have to start building that trust immediately with those providers as soon as you start emailing them, as soon as you meet them face to face. Now, I know we can't really shake hands right now still, but what you can do instead of the handshake, and if you're meeting them in person, is make eye contact. That's huge. Making eye contact is a very huge thing. Have you ever met somebody and they're very shy, and they're very shy, and immediately they look down and they cannot keep eye contact with you? I meet a lot of people like that. That I'm when I'm in my professional work mode at work, I am very strong. And then there's people who have met me that cannot. They will just, well, and even when I'm out at the store or whatever, cannot, cannot. And then you meet those people that are very sure of themselves, they're very confident, and they will look you square in the eye and they have no problem holding a conversation. Everybody has that ability to be able to do that no matter how shy you are. And again, while I can be very direct and very lively, I am also a very shy person. But when it comes to this in medical coding, oh, that is something that, yeah, that's where I start to really blossom and shine, because that is what I love to do. And because I love to do that, I am more confident when I'm in those situations. You can get that way too. And yes, in the beginning, it's going to be really difficult because you're going up against having, if you're a brand new medical coder, having limited knowledge. If you are new to that clinic, again, having limited knowledge, but knowledge of medical coding. So always fall back on your training. Okay, so your training is what is going to save you, but you have to work on those things that you're presenting to the world on your own so that you can start building that immediate trust right away. When you meet these providers and you look them in the eye and you speak clearly and you don't mumble, you don't apologize, you don't start off by saying, "Oh, I'm sorry, sir, I don't mean to bother you." That is annoying. I'm just going to be very blunt on that one. It's very annoying. And some people say, well, I'm doing it to be modest and I'm doing it to be, just I'm just having a gentle approach. No, when it comes to this, if somebody's showing that weakness, and that's really what it is that you're showing, is a weakness, and that's going to be okay, well, I'm going to be able to tell this person whatever it is I want to because this person doesn't know what they're doing, versus somebody that will look at the provider in the eye, say, oh, good morning, how are you? I'm your new coder and we're here to work together. So I have a few points I want to go over with you if you have a few minutes. Not asking permission, but just saying, hey, do you have a few minutes? Let's work together on this. So that's what a good, strong coder will do. You can develop those habits. So you want to be able to do that right away. But again, those little details is what we need to work on. If you have that habit of apologizing all the time, there are other alternative things that you can say, and try to get into that habit. Don't start off by saying, oh, I'm so sorry, I'm so sorry. Sorry is only reserved if you've done something wrong. If you've hurt somebody, if you've done something bad to that person, then it's okay to say, I'm sorry, I apologize. But let it have a meaning, because the words that you use do carry a lot of weight. So if you're running around apologizing all the time, when it's actually time to apologize, that's not going to really mean anything. If I'm apologizing to somebody, they look at me like, oh, okay, well, I know that she believes that she did something wrong. Yeah, I will apologize. I'm not above apologizing because I'm not one of those people that has a problem saying I'm sorry. I can say I'm sorry when it's appropriate, but I'm not going to sit here and apologize for coming up to you and trying to help you as a provider to do better. And sorry about that. I had the door open. There's a little net flying around. So, but anyway, so that's something that if you know you have that issue, start working on it now. Okay, there's little things that you can do so that way that the provider can take you seriously. But getting back to the writing part, a lot of people don't like to write. I will hear that complaint quite often. Bleu, I don't like writing. It's not about what you like. It's not about what you like. It's about the skills that you need. And in order to have really good skills, you've got to be able to write. I know a lot of coders that don't like to write. I've proofread many, many emails before they got sent out. I change them and then I send them to the person so they can send it and do whatever they need to do on it. Because when the provider's looking at that email, that's all they have. And if you're addressing them as Mr. or Miss, don't ever do that. There is no reason for that. There's no reason. And don't ever start their name with a lowercase. You always capitalize the first letter of somebody's name. Don't ever get into that nasty habit of doing the lowercase. It literally makes me crazy when I see people do that. I would never do that to people. So I would expect other coders or future coders to get into that good habit and that simple basic thing of addressing somebody appropriately. Okay. You can save all of your, little abbreviations and everything else that you do on texting. You can say that for your own time. But when it comes to work, you got to be in that work mode. Because when you are in that work mode, those providers are going to be more willing to say, okay, well, this is a trustworthy person. I've been in a room full of people and they look for the person who looks like they're supposed to be in charge or they are supposed to be professionally dressed. I've been that person that they go to, because in a room full of women who are insisting on wearing jeans and a t-shirt because they feel comfortable, it's not an excuse. When you're at work, you're at work. You need to be professional. You need to present yourself well. If you don't like to wear dresses, then get slacks. Whatever you have to do, but make sure that you have that professional look so that way they feel comfortable approaching you. Because again, I've been next to a coder who had on jeans. That wasn't even my clinic. The provider came up to me. Oh, well, I heard the coder was over here. I have a question. Well, actually, she's your coder. oh, I'm sorry. And then they just look at them. And you can tell, what that look says. So again, it's the details, guys. It's everything that you present to the world. It's everything, every single minute of the day. It's not just in the coding. Hi, Edel. Thank you for joining me. Hi, Tabitha. Hi. Thank you for the happy faces. Hi, Ellie. Thank you for the blue heart. Human. Is that how you say your name? I hope I said it right. Thank you. Thank you for the blue hearts. Maria. Thank you. That's what I need to work on. I'm from the South where we do that a lot. So, and I think that's anywhere and everywhere because I've seen it done in the North too. I spent a little bit of time in Michigan. So I've seen it done up there as well. So, but learning these things is going to take time, just like learning medical coding is going to take time. I took training through the Arbinger Institute, and that really kind of changed how I approached providers as well. Because before it used to be, I would think that, these providers are doing this and it's because they don't like me and that's why they're acting out on the documentation. And no, it's actually not it, because how they interpret what I'm saying is literally how it's coming out on paper. So I had to work on better describing the why I needed this, or what was the book saying, and showing them the book really did help. So having those tools in front of me to show them, having those visual aids really did help. So if you're out there and sometimes what you feel like you're saying, or you feel like how you express yourself and how you express what you're trying to put across is not clear, then the help of visual aids will help you, because that way they can see. Because sometimes it is about not just speaking, but actually showing. Okay. Maria, I figured that that's what you were talking about. And I'm glad. Thank you. Yes. Hi, Cherie. Thank you for the blue hearts. So that was my main point tonight, is building that trust right away. And when I'm seeing coders do that, call the doctor Mr. or Miss, it makes my blood boil. And I'm not even the doctor. I can't even imagine what they're thinking. And you always have to put your best foot forward. When I always think about this too, how these providers, how I behave with these providers is how providers are going to associate future medical coders. When they leave me, that's what they're going to be associating coders like. So I need to do a good job of representing coders well. So that's how I always think. That's why I never sit there and try to be disrespectful or say anything that is not going to be useful. Okay, if I have nothing useful to say, I will not say it. No matter how badly I may want to say it, I bite my tongue. And there have been instances where I have been with providers who have a lot of trust for me, providers who have had just a really bad day, and I happen to be in the wrong place at the wrong time. Yeah. And I got yelled at unnecessarily. And because this provider had been doing that, he had done it more than once. in a short span of time. And I just happened to always catch him when he was just in a bad mood and he was just yelling and going on. So finally I said, okay. And I walked away from him. I didn't say anything. I just walked away. There was no, I'm reporting you. No, there was none of that. It was just, okay. And I just walked away. Because sometimes that's what you have to do when it gets to be where there's no other communication that you can possibly come forth with, right? But having that in the back of your pocket, right, where you can say, okay, if it ever gets too hairy, and even if I do have a very trusting and good relationship with this provider, I can always walk away because no one should tolerate disrespect at all. Doesn't matter who you are. Edel says, Bleu, it is very difficult to land on a medical coding job, and I've been looking for a medical coding job for a year, and now I have a job, and I'm starting a patient appointment specialist. Do you think this will help experience-wise? If I'm being very honest with you, no. No, because this will, I've said it in many videos, patient appointments, scheduling will not get you any kind of experience in medical coding. It will not get you anything transferable either. So what you really want to do is find a job in medical records or in medical billing or in prior authorizations or applying for a temp agency. Temp agencies have all kinds of jobs sometimes for medical coders, because there's temp agencies for medical personnel, and then you can find a position that way. So when you do go into those positions that are going to give you those experiences in medical coding, then that will start to add up. But as far as a patient appointment specialist, that is not going to get you very far. And I would be very interested to see your resume, although I do charge for that. But you know, resumes, I've done a lot of videos on resume tips. And if you haven't seen them, then you need to look through my videos and check that out, because resumes and how you present what you know is huge. And if you're taking these assessment tests from the workplace, then that's going to say a lot too, because if you're not passing those assessment tests, then you need to keep studying, because having your credential is one thing. Being able to know the coding rules so that you can at least pass those those employment tests is going to be another thing. So I don't know what your situation is, Ito, but that would be my advice. You can work there as long as you want to, but you can still keep applying for medical coding positions or risk adjustment, medical billing, prior authorizations, that kind of thing. Samantha, hi, I'm new. I'm having a hard time passing the CPC. Can you give me some encouragement? I'm on try number 4 and I passed all my classes. And Needle, I lost hope after looking for 12 months. I don't know where you're looking either. And sometimes that has a lot to do with it too. If you're not applying everywhere, or if you're waiting for them to say, you know, this is an entry-level position, you know, you don't have to have experience, you're going to be waiting a long time. If you're applying for positions that is asking for experience, then somebody will, if you have a really good resume written, if you present yourself well, you know, that your chances of being called back is a little bit better. But Samantha, as for being on try number 4 and you passed all your classes, so there's a couple of things that's probably happening. Either you get nervous with tests, or you're cramming the night before your exam. If you have passed all your classes, then you know what you're doing. This is just the final lap. Okay, this is the final lap, and you are you're just rounding the corner basically to get to the finish line so that you can get your certification. Are you pacing yourself well? And here's the thing, a lot of people will get caught up on one question because they want to get all the questions answered correctly. They want to you know, spend all this time on this one question, and then all of a sudden, by the time you know it, it's 30 more minutes that you have left on your test, and you still have 30 questions to go, and you know you're just going to be guessing so that you can finish and fill it out. Of course, that's not the way to do it. You know, you want to make sure that you are giving yourself every opportunity. there is going to be certain parts of the certification exam that you're not going to understand. Okay, whether it is anything in cardio or ortho or neuro, there's always going to be that one specialty that's going to give you trouble. If you know you have a problem with cardio, right? Don't even try to spin your wheels when you're sitting there in the certification exam room, right? Look at the choices that it's giving you, because the CPC exam is all multiple choice. Okay, so there you got that good one, right? What? She says, I have test anxiety and I'm good with ICD-10, but not so good with surgery and cardio. I get the same exact score every time, but I feel like I'm doing well at studying. You know, the whole thing is, majority of it is all the procedure coding anyway. You only have 10 diagnosis questions, like dedicated to diagnosis questions. So you really have to start practicing a little bit more on your procedures and how you're doing that. But as I was saying, if you know that you are not strong with cardio, don't waste your time spinning your wheels trying to figure out what the procedure code is. Look at the answers that you have available, okay? Do your process of elimination, because you know 2 of them is not going to make sense. And then you have 2. It's going to leave you with 2 options that are left. And when you have those 2 options that are left, then now you're down to between those 2. So just choose whichever one that you think best describes what happened. So I'll get to that in a minute, Cherie. But that's what I can tell you on those. Look up in the tabular, look in the tabular section. Make sure that you're not wasting a whole lot of time looking through the book. I know that you have to be familiar with this book if this is your 4th run at it. Do not cram the night before that exam. Don't. You're not going to learn anything new. All you're going to do is freak yourself out. 2, make sure that you flip through your entire CPT manual. Literally. Flip through the whole thing. I don't have mine with me. It's in my room. But flip each page. Look at each page. And I'm not kidding. This is something that's going to be different from your study habits that you have. If you're getting the same exact result, then you need to change your approach, right? So when you are changing your approach, then you're going to get a different result. If you're doing the exact same thing and this is going to be your 4th time taking the test and you've been studying the exact same way, you're going to get the exact same result. So now it's time for you to do something different. Take your CPT manual and open it up and flip and look at each page. You don't have to read every single word. And it's not going to make sense to you. Like, why am I doing this? Opening it up and flipping and looking at each page. Because it's going to get it into your head where things are in the book. When you are in that test center, that's the problem, is that people get hung up on where stuff is in the book. And then they start flipping and they start panicking. And then you can't find codes, and then you wonder, why did you do this to yourself, right? So just make sure that you open up the book, start looking through each page. And like I said, your brain is going to be able to recall where things are in the book. If you have tabs all over your book, some people feel like they can't live without those tabs on the book. If you are practicing, if you have been going through the workbook, if you've been going through the exercises, you're not going to need those tabs. Those tabs are going to get in your way. So that's the thing that I always say. I hate tabs. When I first took my test in 2008, when I took the CCA, I didn't have tabs because AHIMA was very strict back then. There was no tabs allowed on those books, and so I had to learn hardcore, the hardcore way. Like, you don't mess with tabs. And now, if the tabs come with a book, AHIMA does allow it, right? AAPC, they love to tab their books, so they are welcoming to tabbing. But to me, again, those tabs get in the way. If you haven't had a chance to sign up for justcoding.com, justcoding.com, this is not an ad for Just Coding, but they do have a free subscription and they have a paid subscription. If you sign up for their free subscription, they will give you access to free 5-question coding quizzes that cover diagnosis coding, CPT procedure coding, and ICD-10 PCS coding. So if you are sitting for an inpatient, one of the inpatient certifications, or inpatient is covered on your certification exam, then that is a good place for you. They're all multiple choice, but I always tell people to cover up those options so that way you can look at the question, look it up in the book yourself, and then look at the options that they have and see if any of those match what you have. And start practicing that way because it is free. And, you know, I've heard before, well, Blue, those were too easy. And, you know, do you know of anything else? Guys, it's a practice and attention to detail. If you are not paying attention to detail, that's what's going to get you. Because a lot of times, so many times how many times have you seen, even in a practice book, that they will have those questions where it just seems like there's just one thing off, one little thing off. I've seen a question that has morbidity and mortality. And it was just that one word that just changed the whole meaning of that question, those two questions. So that's what you really have to pay attention to. It's all about those details. And when I'm telling y'all it's about details, it's about details. So give yourself the option of doing something different when you're studying. And again, do not cram the night before. This test is a physical paper. That's all it is. And when you are thinking about like your test anxiety and how you feel and how it's just like you've got so much pressure on yourself, you really have to stop that because you're sabotaging yourself every single time. So I want you to write down somewhere where you can see, I will pass the CPC. Wherever you got to write it down, on a whiteboard, on a sticky note, anywhere that you can, you got to write that down so that way you can visualize and see that you are going to pass this exam. If you've passed every single test that you had while you were in school, you can pass the certification exam. Don't waste time on things that you don't know. Make a choice and move on. Don't sit there and spin your wheels. And if all else fails, then you're just going to do it again. But change your approach on studying. You're doing the same thing, so you need to change your approach. Instead of doing the same exact thing, if you're getting the same exact result, then you have to change. So that's just going to be my advice on that one. But you can do it. If you've passed every single test that you had while you were in school, you can do it. And I look forward to hearing the results when you get them. And just believe in yourself because you're going to be the only one that's taking that exam. And if you keep thinking the same way, like, what if I fail again? No, why don't you think about when I pass this certification exam, this is what I'm going to do. I'm going to go get a manicure. I'm going to go get a pedicure. Or I'm going to go out to eat. When I took my CCSP earlier this year, that was the first thing I did was hit Texas Roadhouse afterward. Because it was just like I had sea legs walking out of there. But, you know, I took it and I got it now. So the CCSP. So, but you have to believe in yourself. And it's all about, it's going to be up in here. So don't let that anxiety take over because it's not worth it. It's not worth it. You know better than that. You know that you can do it. You know you've got those skills. You just have to be able to show it on paper. Pay attention to details. So hopefully that motivated you a little bit. I know that's what you were looking for, but those are my advices anyway when it comes to that. Cherie, so in every video when it's updated, right, I have the whole list of all the books that I recommend. I have the independent study video, and in that independent study video, when you click on it, in the description box, when you click on that, right, all the books that I recommended are right there. They're all right there. I'm sorry, you guys. This is what I get for leaving the door open. But anyway, it's all the books that I recommend are all right there. You can even Google medical coding workbooks. You can actually look at the AAPC test prep manual or the AAPC study guide. People will try to correct me every time. Guys, you know what I'm talking about. The exam prep manual for the CPC. That is a very good book. I also recommend the American Hospital Association ICD-10 CM and ICD-10 PCS workbook. And you can get the 2019 version. You can get the 2020 version. You can get the 2021 version, okay? They all have the answers and the explanations in those books. They have some that are published with the answers, and then there's a book I think out there without it. So that's all you have to do is just Google. I mean, it's not. I don't have a secret on where I get mine. But if you're looking for the exact titles that I recommend, it's in that independent study video. And that is literally on any video that I have posted this week. And when you click on that, all of that information will be there. And even at the bottom of the video, I still have other books that I recommend as well. So hopefully that will help you. Jenny, oh, I need this talking to providers discussion. Funnily enough, I just did a project on this at school. They're making me do a coding course. I'm learning PCS. That's new. Yeah, it is. Do they still allow to label them? The tabs labels have helped me on my second try. I'm talking about AHEMA. That's AAPC is something different. They allow tabbing. Jenny, no tabs, mind blown. I live by my tabs. Oh no, they get in my way. Like, get out of my way. I took the next says I took the test multiple times. I took the test. The multiple choice exam helped. And with the case studies, I focused on the primary diagnosis and the procedure, which gives more points. I passed, but yes, focus on where you are scoring the lowest. Jenny, it's so much detail, especially in CPT, reading the description of the code and looking at the note, making sure that they do this, that. Yeah, it's a lot of paying attention to detail. Yes. Jenny, visualize you're gonna study hard and win. Think of failing and it will more than likely happen. It's all about thoughts and attitude. Yes. The next says testing is stressful, but you have to find the balance. You can do it. Jenny, I have a good coding book in my class that has the answers. It's amazing, and I would have loved to have this I would have loved to have it if this was the first time I was learning it. Does Faye Brown still make books? I don't think so. I don't think so. Faye Brown was from back in the day, ICD-9. But I don't think Faye Brown has done an ICD-10 book. Let me see. I can Google that. We had some rain here. It was so nice. That's why I had the door open, because it was so nice to hear the rain. Faye Brown. ICD. No. ICD-10 Coding Fundamentals, a comprehensive guide for healthcare professionals by Faye Brown. So I guess Faye Brown did write a book about it. Yep. That's what it says. Yep, it's out there. So all you have to do is check it out. All right. Samantha, thank you for all the encouragement. I really want to be a coder, so I'm going to keep trying. Good for you. Okay, you got this. When are you sitting for your certification exam? And are you not going to cram the night before? Please don't cram the night before, because again, that's all it's going to do is mess with your head. You can't learn anything new at the end. At the end of the day, you can't, because you've already gone over it so many times. December the 4th, I am not going to cram. I am studying about an hour every night. Good. And how is your speed? Are you working on your speed? As far as like looking up codes in the book and signing up for Just Coding so that you can get that extra practice. And you're getting more encouragement from Jenny. So, but yes, it takes work, folks. It's not easy. Nothing is. Anything that's worth it is going to make you work for it. Medical coding is definitely worth it. when I look at all the things that I get to do. And some of it is stuff I really enjoy, and others, of course, it's going to be a chore, but it really all depends on how you look at it and your attitude. I look at the things, the relationships that I built with my providers, and how they trust me, and how they've gone to other places, and they have good feedback from their coders. They say, wow, you were really trained well. Hello. Yeah, because you never know who your coder is going to be. And I always tell providers that you never know who your coder is going to be. What kind of attitudes do they have? I said, I have my own YouTube channel. And I said, and I get people from all different kinds of spectrum. I get people who are really gung-ho about coding. They want to be a coder. They want to learn. They enjoy learning. And then I get the others that are in it for the money. And that's why I say I don't talk about money on my channel. I only focus on, what it is, and what is medical coding, and what is it like, and things like that. That's what I focus on my channel. So hopefully planting that seed into the next generation of medical coders will be, better for the industry. At least I hope so. Samantha says, speed is still slow. I get caught up on reading the question and making sure that I'm not missing stuff. See, you have to work on that. The speed will come, Jenny says, slow and accurate versus speed at first. The next says, coding keeps you up on your toes. The codes change every year. Yes. And perfect example being that low back pain has changed. There's more codes. It's more specific. 2022 has more specified low back pain codes. So that code got deleted. M54.5 got deleted. And so now it's expanded. And so that's something that you need to pay attention to out there, because, well, when those codes update, they update. Jenny says, my class has some people that have already checked out of coding. My professor asked, and someone said they liked it. I silently cheered. Carissa, I want to be a coder so bad. I had a medical billing and coding interview today. I feel like it went well, but who knows? Well, we're going to keep our fingers crossed. We're going to keep our fingers crossed, because you never know. I always tell people, when you go in for an interview, act like you're talking to your friends, okay? Not like the, hey man, how's it, not like that, but like you're meeting with friends, because the more relaxed you are, the more good energy you have coming out, the more they will relax. And your interviewer will be like, you know what? I really liked that last person that we interviewed. They seemed like a really good fit for us. The more relaxed you are, the more confident that you are appearing, because you're there. You know the fundamentals of how to code. You're going to learn other stuff along the way. And so as long as you have that, you got a lot going. You got more going for you than you know. Jenny, don't tell me that. M54.5 is ingrained. Yes. Unfortunately true. Yes, back pain. I found out today. Samantha, that is true. My class was right when the 2021 books came out and all of the COVID changes happened. 2020. Jenny, I do a lot of injury, urgent care, imaging stuff. Right up my alley. I love injuries. The next says, I started out as an HIM file clerk and now I'm coding. More in that transferable position into coding. So that's good. Jenny, I told my supervisor in my new job interview, when asked about working from home, my cat was my favorite coworker. Carissa, yes, I feel like that fits me. I was relaxed and I just acted like myself, but professionally. Well, good. And so we'll see. And if worse comes to worse and you have to go on another one, at least you have that experience. The more experience you get, the more relaxed you will get with these interviews. And the more that you'll be able to be yourself. A lot of times when people get nervous, they're not themselves. And a lot of times you think back on all the things that you could have said that were smart and clever and funny, and that you really could have had the whole thing. But because your nerves got to you. Nerves can really rain on somebody's parade, right? They can really ruin things when you think about it. Nerves are good because they can propel us forward in those times of emergency. But when we sit there and have time to think about all these things, and then we start kind of working ourselves up into a lather, and it's just like, when you're going for either a job interview, or you're going for your test, or you're trying to decide and you're on the sidelines and you don't know, guys, think about this. We only have a limited time that we are here. We don't know how long our time is. Do you really want to spend it on the sidelines, wondering and wishing and thinking and hoping that, oh yeah, you should have done this, you should have done that? Do you really want to get to retirement age and think, man, if I would have just did this, or if I would have just did that, I could have had a completely different career? Fortunately, I get it, right? Fortunately, sometimes you have those moments where you get it. And I finally got it in 2014 when I had that aha moment. And I enjoy every single day. Even though there's things that I don't like to do, but I still enjoy what I do. It's not even work anymore. You know, they say, if you love what you do, you never work a day in your life. I'm not working, and I haven't been working since 2014. So I feel like that's a pretty good thing. You know, I don't ever want to retire. I don't. I hope I stay spry and sharp so that way I can just keep going. Because I feel like I'm always going to be in it somehow, some way, either teaching or doing something else. But I will always have my hand in it somehow, some way. Jenny says, my director showed us a wonderful motivational video today at our new fiscal year meeting. That's good. It's always good to be motivated. It is always good to be reminded. I think as adults, we forget to remind ourselves, right? When we're kids, we always have somebody encouraging us and telling us, good job. That was a good job, or I'm proud of you. You know, either it was our parents or if it was our teachers, we always had somebody right there cheering us on. As adults, though, it gets a little bit different. Sometimes you have coworkers that are not so happy for you, or you'll have even your own family members that are sometimes not so happy for you. And so that encouragement is a little bit harder to get because sometimes people find themselves jealous and they feel like, oh, I wish I could have done that. And, you know, who does so-and-so think they are? You know, that they think they can do that. Anybody can do anything that they want to do, right? If you want whatever it is that you want, make a plan and work at it. That's all you have to do. But that is the hardest part, making the plan and actually going through it. You know, sometimes we have to take a few runs at things. It's like people who want to stop smoking, right? You know, sometimes it takes them a few times, you know, to actually stop. And you see them, they try to make that concerted effort, you know, for their families or for their own health, you know, but they have to stop. You know, same thing with the person who drinks. You know, they can't help it, but they try, and sometimes they have to keep trying until they finally give it up. So it really all depends on the individual. And then you hear those success stories about people who have turned their lives around. Look at Robert Downey Jr. You know, now he's like one of the coolest actors, at least I think. You know, I enjoy his movies, but there for a while the guy was a mess. You know, but he pulled himself together. He turned it around. It's the same thing like you can do. If you're one of those persons that says, oh, well, I saw somebody who was on not Instagram, LinkedIn, that was saying that, oh, I've always failed at life. Why I can't seem to do this. Okay, if you're already starting with that mentality, that's what you're going to beget. Your energy begets more energy that is similar to that energy, right? So the more defeated you feel in yourself, the more you're going to attract that defeatedness, right? The more you're not going to be able to get what you want, the more you're not going to be able to do the things that you want to do because you're inside your head saying, no, I can't do it. Instead of saying, yes, I actually can. Because you know your own capabilities. You know, at the end of the day, when it comes down to brass knuckles, you can do whatever it is that you want to do. But you have to stop telling yourself, oh, no, I can't do this, or I can't do that, or I could never do that. It drives me nuts when I hear people say that to me. Oh, I could never do that. Oh, Blue, you know all this stuff. I could never know all of that. You know how long this thing takes to learn all this stuff? This is a commitment. It is a 10 to 20 hour a week commitment on top of everything else I got to do. But it is a discipline that you got to have. If that's the kind of life that you want, then you have to. If you really enjoy what you're doing, you have to make a way for it to happen. You know, and sometimes when you see people that are so defeated, like what I saw on LinkedIn, you can't reach those people. You can only reach people that are willing to change how they think and go into those different thought processes instead of that same ugly rat race of, oh, I can't do it and I've always failed. Why don't you say, I've had some experiences where I've gained and learned from what I've done. I know this does not work. I know if I keep doing it this way, I know if I want to lose weight, and I know if I stay in bed instead of getting up at 5 o'clock in the morning to go for that 30-minute walk, I know I'm going to end up gaining more weight because I'm still doing the same thing. I'm laying in this bed, not doing nothing else. On the other hand, if I actually start making that first step and doing that 30-minute walk, I'm not going to see results overnight, but I am going to see results 30 days later when I'm going to look and see how I look today versus how I will look in 30 days. Too many people want things instantly and right now. You can't have it instantly and right now. It's not going to happen instantly and right now. You have to be patient and wait for it. Because if you're always going to want it right now, and that's the problem. We live in that society where they like TikTok, right? Where they want everything done in 15 seconds. Somebody was complaining about my videos. Oh, ma'am, these are too long videos. You need to shorten. Hello, the time it says right there clearly how long my shows are. My shows have always averaged in the beginning 25 minutes. That's never been a secret. You don't want to watch something that long, then go watch something else. Because I sure as heck I'm not going to sit here and speed through and do something fast to appease a small amount of people. I'm not going to do it. I'm always going to do it the way that I want to do it. And I think I'm doing something right. I'm hitting almost that 14,000 organically grown subscribers that I didn't have to do anything but be myself for. So again, things take time and it takes patience. And I'm going to keep doing it that same way because it's going to end up being useful for somebody. At least that's just what I think anyway. Yep. That is very true. That is very true, Jenny. Jessica, what is your advice on transitioning from specialty Euro 2+ years to hematology? Neoplasms are confusing and scary. Learn it. Learn it. Learn it. Learn it. Whether you are working in just a specialty like urology and you're transitioning over, the best thing that you can do is learn that specialty. Look in the CPT manual. Look at all the procedures that are available. Even if your clinic is not doing those procedures, look at all the available procedures that you have there. Go to websites that specialize in the new specialty that you're going to be in and go from there. When I went from the neurology clinic and they added the pulmonary clinic. Pulmonary clinic was drowning. They were drowning. They were like, we don't know what the problem is, but we need to see improvement because something's not right here. Okay. Again, pulmonary clinic needed some resuscitation. All right. So Bleu, get in there. Okay. Well, I have done hit and miss pulmonary, but I've never done pulmonary clinic. I had done prophy coding before, so I'd seen a lot of pulmonary patients on the floor, but never like, okay, well, I'm going to be, I'm working in the pulmonary clinic. I know what they do. I know about the pulmonary function test and all this stuff. I did not know. I did not know any of that. First thing I did was I went to the American Lung Association. That was my first stop. I started reading everything I could. I went to the CPT manual and I pulled up all of the available procedures that I knew that were going to be for the pulmonary, like the pulmonary function test and all those things. So that was how I started to learn. Well, lo and behold, I find the problem. So what had happened was they thought that when this procedure was done this way, that it was actually this code. No, it's actually this other code. So going back through in the audits, I was like, oh, okay, well this is what it is. This is actually what's happening here. This is what is actually supported, not this other thing here, because while they may think that that's what it is, that's actually not. And they were just wondering, like, okay, like what's the deal? Like why is nothing going through? Well, because it's actually this other thing. So it got all fixed. And who saved the day? And for somebody that did not know nothing walking in, like what they actually do, like if you were to pull me out of ortho and then implant me to ortho at another hospital in another state, I'd be able to pick up right where I left off because I already know what the ortho clinic does. I already know what the podiatry clinic does. But when you implant me in a new place, I immediately go into research mode. I start talking to the providers. I start talking to the nurses that are on the floor. And okay, like, what is it that you guys are doing? I had a lot of talks with those techs that do the pulmonary function test. I was like, oh, okay. I was like, well, what is it? What does it look like? What are you trying to, what is this saying here? Oh, okay, that's what that is. Oh, okay. And that's all you have to do. So it's literally just kind of being boots on the ground and looking at what you got and looking at what's in front of you, talking to the providers. And when you don't know or understand something, then you got to start talking and you got to say, okay, I don't get what they're doing here. And then by the time you know it, this was the first week that I had done that when I was doing that for pulmonary. And the girl that was actually working in that clinic, she's like, oh no, I didn't know that. I didn't know that and I had to tell you. Come on. I'm just saying. Ellie says, CPT multiple procedures with modifiers are draining to me. Woo. There's ways. You'll learn. You'll learn on those. Desiree, I thank Almighty God for you following your heart in this field and helping others that aspire to go into medical coding. You truly are a godsend to many. Thank you. Thank you very much for those kind words. That makes my day. I appreciate that. Thank you so much. Jenny, this I need to remember since we do multiple specialties. Yes. Have you done any anesthesia coding? Yes. A long time ago. Jessica, you're welcome. So, but yeah, that's what I would recommend. That's what I always recommend. Whenever you have to go into a new clinic, start doing your research and don't wait. Start doing it right away, because the longer that you sit there and even if it's just a pride thing and you think, oh, I don't want to have to ask anybody. You don't have to ask anybody. You can start by looking online. Start by looking at anything that will help you, any sort of helpful references. I was tutoring somebody who was struggling with family practice. And now I haven't done family practice in a good long while because I've always been in the specialties, right? So I have helped out here and there, but never actually like, okay, this is my clinic. So looking it up, I think the association for the American Association of Family Physicians or something like that, that's the one that comes up. But that one was really good. Lots of really good information about coding on that website as well. So it's just like, at least I think that's what the name of it was. But it was really good. If you're going to into the specialties, you want to look for those helpful websites. For ortho, it's orthoinfo.org. That has a lot of really good information about like injury codes, not the specific codes themselves, but the process of the injury, right? Or even just the organic conditions, what they are like and what the symptoms are, what the treatment is. And even though you don't need to necessarily know what the treatment is, it's nice to have that idea of, okay, this is what they do for that. you know, so hopefully that will help you. Those are the things that I like to look for, because once you know how to code, you can literally code anywhere. I mean, they can put me in cardio tomorrow and I'll be able to pick it up. Now, it's not one of my favorites. I have done it before. It's one of those ones. It's like, I'd rather work in the ophthalmology clinic. But I will take the challenge if I need to. I always do. I'll rise up to meet that. I have no problem with it. However, if I had my would rathers, I'd rather another clinic. But people would say that about ortho as well. So, you know, what are you going to do? Oh, you're welcome, Ellie. And I hope you have a good weekend as well. Thank you for the blue heart. But yes. So, all right, folks, that's my message. Building that trust right away. It starts with the details, guys. It really does. It really starts with the details. When you take the time and you actually care about what you do, and you care about the appearance of your emails, you care about your speech and how it sounds. And yes, while I'm an infotainer, and yes, well, if you look at some of my very early videos, you'll see a huge difference in my speech, in my speech pattern and how I speak. And did I do a lot of and ums and yeah, you know, and yeah, did I do a lot of that? Of course I did. However, it didn't stop me from putting those videos out. I kept going with it. So when you do that, you get better. You get better with time. And I know that speaking in crowds has gotten a lot better for me. Even now that I do it. In the beginning, was it easy? No. It was not easy in the beginning. It was not easy being that first person the first time to go to a new provider and say, hi, I'm new. I'm your new coder. And we're going to work together. Was that easy? No. When I got put into the pulmonary clinic to rescue them, I had to go in there like I knew what the heck was going on in pulmonary. And when I met the new chief of that department, boy, you want to talk about a firecracker. That woman's tough. Woo, she was really tough. And I had to go in there and suck it up and be like, hi, how you doing? I'm Blue. Oh, hello, who are you? I'm your new coder. Okay. And did she argue with me? Oh, yeah, she argued. Woo, loudly. She was very convinced and very sure that she was doing the correct thing, because she didn't have a lot of access to coders back then either. And so I was the first one that had actually went up to her and said anything. And she let me know about it too. And so it was a lot of months going back and forth with her. And finally, when I did not give up on her and she started working with me, she started doing the things that I asked her, because she started to see improvement. And then we started seeing everything going back to normal, everything normalizing, and everything going through and approved, and everything's going to be okay. You earn the trust that way. But she knew I was there on business. She knew that I was not going to give up on her, no matter how she was very sure or what she said. I was not going to give up on her, and I didn't. I kept after it until finally, like I said, everything normalized. And when I had to actually turn that clinic loose and let it go to other people who were just going to take over it and just basically, okay, take care of, check the box and everything's good, because I had fixed everything. That was hard. It's like, you know, it's like you seeing your kid graduate. That's what I would imagine. I don't have kids, but I would imagine that's what it's like, you know. You got to let them go. You got to let them go and fly and do their thing. That was very hard. That was very hard. That happened to me not once, but a few times, quite a few times with these clinics. And it happened with neurology as well. Neurology completely turned around. And when you talk about turnaround, that was a turnaround. Nobody wanted neurology. And when I went in there, same thing. Now that one I cried. I cried, not in front of the provider, but, you know, I held it together. But, you know, later on, yeah. Yeah, later on I cried. But they're still doing good, at least that I know of. You know, You always got to leave the provider better than when you got them. That's what I always say anyway. The next says, I love cardiac cath, but the spine procedures, I have a problem. Laminectomies. Ugh. It's so intimidating. Yes, it is. Jenny, girl, I would be shaking in my boots or tennis shoes. I have shook in my boots before because I do wear cowboy boots, you know. With my dresses, I will wear cowboy boots, but yeah. But you gotta stand there and be like, smiling. But like, you know how the ducks are, right? They're very calm. But then if you look under the surface, their little feet are going like that. Yeah, that's been me. But I still have to have that. Okay. If they see me panicking, they're going to panic. So I need to show them I'm in control of myself and my emotions and how I feel and what my confidence level that I know, you know. Or the best part is when they trust you and they'll bring somebody from another specialty over to you. And you'll see them. They say, "Oh, this is my colleague from such and such other clinic. They have some questions. Okay, well, why don't you go to your coder in your section? Well, they're not there. Oh, okay. Well, how can I help you? You know." So, and it's just like they go, "Oh, well, I know who can handle it." You want that, guys. You do want that, and trust me, all the time that you spend with all the details, it will pay off. I will try because I care. There you go. That's right, Jessica. That's the way to be. But you can do it. You can do it, especially because you enjoy it. You'll be able to do it. But start doing your research. Look on YouTube and look for any of the procedures that they do in your clinic. If they are doing any kind of anything, right? Look up those procedures on YouTube and you will be able to see those. I did that with ortho when I was doing same-day surgeries, and I had trouble with meniscus procedures. So I started looking it up on YouTube. And I'll tell you what, that was the difference right there. Now I got what they were doing. And I was like, no, that makes sense. Shannon, thank you for this topic. I'm shy, so I appreciate the nudges to go outside of my comfort zone. I need to go bold and push myself. Yes, you do. And then when you do, and you do something like that, you step out of your comfort zone and you extended your first hello, celebrate yourself. Give yourself the pat on the back. Because remind yourself that it's baby steps, but collectively it will pay off. When you keep doing it and you keep moving forward, it will pay off, because those little steps at a time will get you better and better every time. But you're never going to get anywhere if you still stay in the same place with the same mentality of I can't do it or I could never. When you start changing, you'll start seeing things go differently. Nancy says, hello, Blue. Do you think getting the CCS and CPC starting out will make me stand out when I'm looking for a job with zero experience? I'm so wanting to start my program, which offers both, but I'm so scared. Nancy, all you need is one, honey. All you need is one. And no, having both will not get you jobs faster. It will not get you noticed more quickly, because you have to understand what the CCS is versus the CPC. Now, I never wanted to do that video, but I was forced into it, so I did it. But the CCS is the gold standard of medical coding credentials. I will always say that, because this one credential says that you have mastered the inpatient setting and the outpatient setting. So you have to know both the CPT manual and the ICD-10 PCS manual. And if you have not learned the ICD-10 PCS yet, you are in for fun. And when I say fun, I mean fun. Like about as much fun as a root canal when you think about it. But it takes a little bit more finesse, because ICD-10 PCS, you have to build those procedure codes. It's not like the CPT manual where they're all built for you. PCS, you have to understand that. And you got to understand the DRGs, and you got to understand MSDRG, and you got to understand CC and MCC. And there's a lot of other things for the inpatient side that you got to be able to understand in order to sit for the CCS exam. Again, if you have that CCS though, you can go anywhere, inpatient setting or outpatient setting. So if you're looking for the credential that can give you the most chances to apply at more places, The CCS is the way to go. However, if you are looking at taking the CPC, Certified Professional Coder, that is with AAPC. That is only the outpatient setting coding on that certification exam. There is no inpatient, no ICD-10 PCS, no MSDRGs, no MCCs and CCs. None of those questions, right? It is only the CPT. Well, and of course, the ICD-10 CM, the diagnosis coding, okay? They got 10 of those questions directed towards that. And the rest of it is the majority of the CPT manual. It's all the chapters of the CPT manual. So they have questions on those. Now, with the CPC, if you take it at a place that is being proctored, right, you have an optional thing where you can, if you fail the first time, you can take it again for free, okay, if you go to a place. But if you do the at-home version where you're on the camera, you only get one try, okay? So it really all depends. With AAPC also, keep in mind, you have to pay for your membership before you can pay to take your certification exam. With the CCS, you do not have to do that. CCS, AHIMA does not require membership, but they do have a price for members and they do have a price for non-members. AAPC, you have to pay that membership every single year. If you do not pay, they will revoke your credential. With the CPC, you will have a -A for 2 years, or you can speed it up to a year once you start working, because you have to have that 2-year commitment on it, requirement. So you either have to work for 2 years, or you have to work and you have to do this other program that they have. They charge for it called Practicode, where you're coding charts, and basically it's a year, is considered a year off of your 2-year time commitment. So you can get that A removed in a year. The CCS does not have that, okay? When you have this, when you're certified with the CCS, the Certified Coding Specialist, you walk out of there with that CCS, right, when you pass. There is no A on that. People get confused. There is no A. AHIMA does not have apprentice. That is only a AAPC thing, okay? So keep that in mind. And people will say, well, I can't get a job with my CPCA. There's a lot of people who have CPCA who got a job, and especially at the beginning of the pandemic, they still were able to get a job. Even though everything was shut down, they still got a job. So it really all depends on the individual and how their resume looks. CCS, you're strolling up in there with one of the most in-demand certifications out there, okay? So it's up to you, whichever way you want to go. But I've outlined, in short, the two. But either one. But you do not need both. Please do not get both, because all you're doing is wasting money, especially if you're brand new and you have no idea what's going on. Only get one. Get your time in and then move on. If you have the CCS, there really is no reason for you to get the CPC, honestly, because your CCS already says that you can code the outpatient setting, which is what the CPC says. Now, there's a difference if you start off with the CPC and you want to go over to the CCS because you want to start doing the inpatient side, or maybe the facility that you want to work at says we want an inpatient coder, but they have to have a CCS. Okay, well, here you go. That makes sense to me. But again, if you get the CCS first, there is no reason to get the CPC, because it's already saying here that you can code outpatient. Hope that makes sense. And keep in mind, I have nothing to sell you, so I have no reason to tell you plus or minus either way. I am just trying to keep you from spending money unnecessarily. So, Jenny, I like your faces. Nancy, thank you. The program offers them together in the same program, so you can pick. Jenny, how I feel. PCS is a whole nother world, yes. However, I feel root operations should be taught when learning CPC. Maria, yep, every year. Regardless of working or not. Rochelle, hi Blue, I love listening. To you? I think you meant you. But it says 6. It It's okay. I think you mean me. Thank you. But yes, so hopefully that helps you. I know you're scared, Nancy, but it's all right. It's all right. It won't hurt you. All it will do is challenge you and really make you think. And then you get around some of these providers, and they're a trip. They're funny. I enjoy most of them because they give me something to look forward to. What are you going to say to me in this documentation? What is it going to say today? How am I going to learn something today? You know, and you see their interactions, and they detail everything in these interactions with their patients. And it's fascinating, and it's funny. And some of it will leave you scratching your head sometimes, and some of it will, I learned something today. Rochelle says, I love listening to you for your knowledge. Oh, thank you. Thank you for the blue heart. Maria, I've learned a lot from your channel. I passed on the second try. Oh, yay! That's awesome. So what did you get, Maria? What certification? What certification did you get? That is so awesome. Congratulations. It's exciting. It's exciting when you pass, and when you have that change and challenge in life. It's exciting. It's new, it's scary, but it's exciting. Nancy, I think I will do the program, but only take the CCS. Thanks for your advice. I didn't know that the CCS also included outpatient. Well, congratulations, Maria. But yes, it does, Nancy. Jenny, if I could go back in time, I would do the CCS. Yes, I say that all the time. For myself, I say that. But yes, inpatient is a completely different animal. But yeah, when I say that, oh yeah. But Jenny says, Jerry, it's Jerry, everybody. Hi, Jerry. How you doing? Thank you for the blue heart. It's so good to see you. I'm so glad you're here. Glad you made it. Jenny says, but my school heavily pushed the CPC, so, and Maria's did too. So the thing is, there's going to be schools that will push the CPC because maybe that it's just sponsored, or maybe the instructor, even though they train you for both, maybe the instructor is a CPC themselves, and maybe that's because that's what they know, or they want to, Jerry, or they want to give people, oh, well, you can retake the test if you fail, if you go to one of those proctoring centers, and maybe that will help you, and maybe that will help to give people like the confidence they need, because sometimes people get very nervous, and with the CCS or any of the AHIMA exams, you only get one shot per payment. So if you fail, you have to pay to take it again. And so that's, AHIMA exams are some of the toughest in the industry, and people will say that. So that is the thing. And then with the CPC, people say, oh, wait, it's easy. The CPC is not easy. I will not say that. I will not say that because there's a lot of people who are very smart who have a hard time passing this exam. So even with the free retake. So I don't agree there. I still think that it's difficult, especially, but it really does depend on how the person is trained. If you are in one of these fast-paced medical coding programs that are just basically herding you like cattle through the school, trying to hurry up and get you out because it's all about the money with these schools, right? Then that is something different. And I feel like, when you push people out and you say, oh yeah, you can get a new career in 16 weeks, give me a break. If you're trying to make people be medical coders in 16 weeks and you expect them to learn everything, no. That's why I tell people, be realistic about your journey in medical coding. Go for programs that are 9 months, 12 months, or 18 months. I get the question though, Blue, well, what if it's only 8 months? I found a program, but it's only 8 months. 8 months is just shy of 9 months. That's fine, but really 4 months, that's too short, folks. 6 months is too short. That's fast. That's scary fast. That's not even enough time to absorb everything fast. And plus, you're going through at lightning speed, breakneck speed. Oh, no. That's too much to get people. And to me, you're going to run the risk of burning people out quick when you do things like that. And then people get discouraged because they can't pass the exam. Why can't they pass? Because they were trying to teach them too fast. And then it's like some people have been out of school for years. And that's another thing too, is that, you know, if you've been out of school for a while, and I was out of school for a while when I went back to school. So that, I mean, I can't imagine somebody who this is going to be a second or third career for them, and they've been out of school for 20, 30 years, and they're trying to go back. That's a lot. It's a lot. It's tall order. I'm just saying. Jenny, your little worried faces. Maria, no, not at all. I know nurses that couldn't pass. There you go. There you go. Thank you. Thank you, Maria. Thank you for saying it, because nurses have said, oh, Blue, I thought this was easier than this. I never knew it was this hard. It's hard, folks. We have to know what doctors know while never having gone to medical school. But I'm a nurse, Blue. I'm a nurse. I should know this. It's different. The logic when we look at things is completely different from what a nurse does, from what a nurse has to think and what a nurse has to know. We are interpreting documentation that is coming from the provider, who it was written by the provider, right? And we have to sit here and comprehend this stuff. And some of us only have a high school diploma or a GED. So yeah, trust me, it's no picnic. It's no picnic with no picnic basket. All right. It's a challenge. It is a challenge. Jenny, I passed on my first go. I know people who have done it twice, thrice, multiple, and finally crossed that line. Maria, I know nurses who have tried it 4 times and still haven't passed. And see, there's that block. It's that block sometimes. And I've heard from a nurse that it was a mental block because she didn't get why it wasn't coming easier for her. And I said, if you're not taking it seriously, the thought process behind how we come up with these codes and understanding the coding guidelines, if you don't put your head around that, then you're going to struggle even more, because medical coding will humble you quick. Does not matter who you are, because there are doctors. Keep this in mind, especially when you hear people trash talking about the CCA. There are doctors out there who hold a CCA. Hold a CCA. That's how difficult it is to get. CCA, CCS, CCSP. These are all challenging exams, and they can be challenging for anybody, regardless of whether they're coming from a medical background or not. They are challenging, and they will humble you. If you don't respect medical coding, oh, it will school you really fast, and it will send you screaming for the hills if you don't take it seriously. That's why I'm telling you, people, please take it seriously. Read your coding guidelines, the ICD-10 CM coding guidelines. Read them once per week when you're studying. Oh yeah, read them once per week, especially if you're going with the ZHIMA exams. Read them once per week, so that even though you're not trying to memorize the guidelines, you're still reviewing them, so that that information is fresh in your head. You're going to know that you saw that somewhere. You can recall it a lot faster without having to memorize, because you can just flip to that section in the guidelines and look it up. Maria says, you're welcome. Jenny, but that came with like 2 years of coding courses and then a lot of months leading up to the test and studying my behind off. Yeah, that's true. And that's what you have to do. Jessica, and the real life coding is so different from the school training. Take your time. Yes. Thank you for saying that. Yes. Yvette, would you recommend self-study for the CCS? Depending. If you have been a coder already, yes. If you have a strong study ethic, yes. If you find yourself a tutor, yes. If you find yourself a mentor, yes, you absolutely can do the self-study for the CCS. It is possible. because it is learning your inpatient procedure coding. It is learning all of those things. If you can learn that from a workbook, then absolutely, by all means, you can do that. You can learn this stuff from a workbook. The coding clinic, the AHA coding clinic, AHA, the American Hospital Association, publishes a book, the workbook for ICD-10-CM and ICD-10-PCS. I have that link in the independent study video, that workbook that I recommend. You guys, I'm telling you, if you're going to be studying for the CCS, that's the book you want to study with, because that book, it breaks everything down. If you've gone to Optum 360 Coding, like I've been begging y'all to go to Optum 360 Coding, Optum360coding.com, they have a book on there that explains the ICD-10 PCS, and it breaks it down, and it does have a book that will give you scenarios and explain the rationale on how they got to those codes. So if you are studying on your own, that is a treasure trove of places to find books to help you to better understand. But yeah, if you have that, oh yeah, you can do that. Maria says, right, facts. Hi, Floor. Thank you for the blue heart. Jessica, I can understand the coding guidelines very well. But when you start reading the provider documentation, I can feel so lost still. Yeah, because sometimes they will put words on there that will be like completely different. Sometimes they'll say torus fracture and it's buckle, or they'll say buckle fracture and you look it up in the book and it's torus fracture. So yeah, they can completely change. Fight bite, they'll say fight bite. I had no idea what fight bite is, but that's when somebody gets punched in the mouth and they had those teeth marks on it. I had no idea what that meant, you know. But yeah, they change a lot of things that they say. So yeah, you have to be ready for that. These doctors are gonna say however they think, and sometimes you will see that they will write things so beautifully. It'd be like reading poetry, and then some of it would be like, you know, what were you? I don't understand. Like, did you not have coffee, or what's going on? Because I don't understand any of this. I'm confused. You got a lot of holes here, sir. And they go, oh yeah, sorry about that, Blue. But yeah. Jenny, that's my book. It's so good. Yes, it is. Yes, it is. Jessica, another language. Yes. Why? Why not? And then sometimes when I look at things and I have to go to the provider and I ask them, and I'm like, why do you do this to me? Why? And then they go, well, what do I do now, Blue? And they go, oh yeah, that one. And they'll start telling me about the situation. But I was like, okay, what are we doing here? What is this? And then they go, oh. And they go, well, and then they start explaining things. I was like, okay, and now I get it. But yeah, they do that. They like to do that. It's like, I said, would you give me like little snacks for thought to take home? Is that what this is? And they just laugh at me. They go, Blue. Really? Nancy, are you familiar with Andrew's School for Medical Coding? Do you have any personal experience with one of their graduates? No, I do not have a relationship with them. I have heard of them, but I've never been to that school, and I don't know anybody who's been to that program. So I couldn't answer that one. What's the name of the book again? So let me see. Some of my friends use Dragon. Dragon is another thing. And some of them are typos. It's like Siri voice to text all over again. Yes. All right. So let me see. I'm gonna what is that book? Answers. They have the 2021 version. Okay, so it is called AHA, the American Hospital Association, AHA, right? AHA, ICD-10-CM, and ICD-10-PCS Coding Handbook with Answers. Now, you can use the 2019 book. Yes, there have been updates to the codes in some instances, yes. But if you're using your coding books and you're looking at it and you know that there's been an update, then you're totally fine. But the rationale still stays the same. But yes, I absolutely do recommend that for learning diagnosis coding and ICD-10 PCS procedure coding. Even if you're not going to learn ICD-10 PCS right now, it's still good for diagnosis teaching as well. So it is called the AHA ICD-10 CM and ICD-10 PCS Coding Handbook with Answers. You can put that into Google and it'll come right up. But if you're looking at the independent study video that I did, I do have the link for the Amazon affiliate link. You don't have to click on it, but the title is there. You can click on that and it'll take you right to the 2019 version. There is a 2020 version out if you want a 2021 version, 2022 version. So it's whatever you want to do when you're looking those up. Of course, with the affiliate links, I may get a commission if you click on it, but you don't have to click on it. It is there. Jenny, as a CPC going through the book, it's even keeping me on my toes. There you go. That book is not a joke. And in the back, when they have the scenarios, oh, trust me, it will make you think, but you'll feel so good when you start working those things out on your own, because then you'll start to be able to think about like how they think. Like for ICD-10 PCS, right? Whirlpool therapy. What is it under? Activities of daily living therapy. That's how you start to find it. Like I would have never thought of that, to put that, because in my CPT head, because I've always been in the outpatient setting, in my CPT head, I'm thinking, okay, I look back for whirlpool. Whirlpool therapy. No. In PCS, it is not like that. It is about the approach. It is about what are you doing, because it changes and is customized for every single situation. Some codes are already there, yes, but there's a lot of codes that are not built, that you have to go back and you go into the index and then you go into the tables and then you look. But if you know what table you need to be in, it's different, because sometimes you don't even have to look in the index in the PCS manual, okay? If you know what table you need to be at, like say for instance, you're doing mom and baby, right? You know the obstetric section, you go back there and then you go to the table that you need. And then you can go from there. You don't even have to look it up in the index. But that's the thing with PCS. It is completely different. So if you're messing around with that PCS book, trust me, that AHA coding book workbook is really good for that. And I strongly recommend it. Really strongly, very strongly recommend that book. Jerry, since I'm taking my time and probably won't career change for another year or so, would you recommend that I get the workbook now, or should I wait until the newer version till next year? I mean, you can get an older book. You can get the 2019 book and still work from that. You don't have to get a new book right now, especially because if you're not going to do a career change right now, you can still work with what you have. If you have the 2020 books, you can get the 2020 AHA book and work with that. You don't necessarily have to get new and updated stuff, especially if you know that you're not going to be doing it for quite some time. It is totally okay to go back a couple of years, even all the way up to 2019, depending on when your ICD-10 CM book and your CPT manual, whichever version you have, the 2020 or 2021, you can get the workbook to match it, the 2021. You don't necessarily have to wait until later on, or you don't necessarily have to get a newer one. Like I said, you can go all the way back to 2019 and it will still be fine. Try not to get anything beyond that, like 2018 or 2017. That's too far back. 2019 is fine. 2019, 2020, 2021, 2022, you're fine. At least that would be my recommendation. Flora, thank you so much. You're welcome. Jerry, I think you just answered my question. Jenny, don't say that we are almost through the book. Jenny, pregnancy equals extraction. This I could not wrap my head around until I literally figured it out. It was a literal explanation. That is very true when you think about it. And see, that's the beauty of the PCS, where it will sometimes frustrate you. It will so much enlighten you. And you're like, now I get it. Okay, so then you're fine, Jerry. You're fine, Caitlin, just passed my CPC. Congratulations. I wanted to thank you. Your videos have helped a lot. Oh, that's so wonderful. When studying, and I'm using them now as I start job hunting. That is wonderful. Congratulations, Caitlin. I am very, very happy for you. I can't wait to you get your first job and you start getting out there. That is awesome. Congratulations again. I'm very proud of you. How amazing is this? I've had a couple people tonight talk about how they passed, and that is amazing. I am so, so glad. I can't wait to keep hearing about your journeys. It's always nice to hear people, and how their journeys are continuing on, because it gives motivation to other people, believe it or not, when they hear that other people can do it. And when people have said, hey, I come from this background and that background, and somebody says, oh yeah, me too. And they did it. So that's so good, and I'm very happy. Thank you for sharing that. But this one went long tonight. I guess you guys missed me, even though I hadn't done a live in 2 days. Sorry about that, guys, but I'm here now. So, but I'm gonna go ahead and wrap this one up since it is getting late. It's already 10:07 on the East Coast. Sorry, guys. But I will see you guys on Monday. I will be back for another live. I will announce Sunday what the live topic will be about for Monday. But I hope you all have a great weekend, and I will see y'all then. Bye.